Techniques for assessing the size and distribution of fat depots, such as visceral fat and pericardial fat, hold great promise for enhancing our understanding of the diseases associated with adiposity. These diseases include cardiovascular risk, diabetes, insulin resistance, and other metabolic conditions. We asked Jeff Carr to provide an overview of the techniques that provide the most information.
Both CT and MR, I would say, provide the most information on specific fat depots, and that I think that we've evolved over the past 10 years that this adds a significant amount of new information compared to bone densitometry or DEXA body composition. So I think compartment-specific measurements of fat in the abdomen, around the heart, or in the liver are much more important than overall total fat burden. I think it's still a research tool. I think the use will not be in using imaging to understand adiposity as much as using imaging as a tool to develop better diets, better interventions, and better combinations of drug therapies and perhaps surgical management for adiposity, as was discussed.
Peter Wilson comments on the use of imaging in addition to biomarkers in special situations such as bariatric surgery.
We have metabolic conditions that we can measure with biomarkers, but this also now gives you something to measure and be used to track as an outcome. For instance, some of the intriguing new studies are individuals who have had bypass surgery, gastric bypass surgery, because of very severe obesity. Then what happens to their visceral fat? What happens to their liver fat? And measuring the amounts of fat both before they have the procedure and after. A natural one, of course, is weight loss itself. But some of these newer modalities, especially after surgery, they're getting answers very quickly.
Some of these techniques are already available. Are they of interest in clinical practice?
If you're seeing patients, I think the key thing is the waist circumference. That in addition to weighing people and calculating their BMI, be aware of the importance of central adiposity as an added risk factor for cardiovascular disease. And you don't need a fancy MRI or a CT scanner or a DEXA scanner, you just need a tape measure.
I think I have to agree with much of what we just heard, is that the imaging techniques, CT and MRI, are very valuable in looking at the relationships between adiposity and actually the properties of non-adipose tissue, and helping us understand how they relate to disease. They don't give us mechanisms, but they give us ideas about mechanisms. And I think those ideas about mechanisms can then lead to help us test ways to better treat patients. At present, I haven't seen evidence that imaging helps us manage our obese patients any better.
I would agree. Imaging, again, can provide very valuable insights into mechanisms of disease and also help quantify adipose tissues that aren't easily visible when looking at patients, as well as tissue depots that aren't visible when measuring waist circumference or body mass index. In terms of the clinical management of our patients, I don't think these imaging modalities have a place to be used clinically, and the best assessment in the office is really body mass index, waist circumference, and then managing the clinical risk factors as they present themselves.
Well, I would see more of an effort towards functional imaging as the next step in research. So now we can get somewhat static images that give us anatomic information, but they don't give us functional information. And I think that the next generation of imaging techniques will give us both anatomic and some functional information about the tissues involved. And I think that when we begin to learn how that kind of research can enhance our clinical understanding, there may be a bit more clinical application for things like that.
Yeah, the current imaging techniques also hold the promise in terms of large-scale genetic studies, in terms of refining phenotype definitions, hopefully a little bit better in terms of estimating body fat composition using methods of CT scanning and MRI as compared to body mass index and waist circumference that are currently available now in very large-scale settings.
So I guess my last comment would be that in addition to understanding the anatomy of these depots, that we need to do a better job of understanding how they're functioning in humans, in living humans, to know the size may be important, but I think it's critically important to understand their function, or more specifically malfunction, and how that's contributing to the problems we're seeing in patients.